Professor Amering, please describe the concept of patient recovery.
Psychiatry is a specialty where many people do recover. They recover early from mental health problems if they get help, but also people recover after a long time of suffering, for example, from schizophrenia. But we don't know about them because people don't brag about having recovered from mental illness or mental health problems because of stigma. So the user movement has come up with this idea to take ownership of the concept of recovery, talk about it, conceptualize it, and give it also to us professionals to deal with it, to learn about how people recover, what makes them recover, help them recover better.
How about acceptance for this phenomenon or for this aspect?
It comes with the democratization of medicine and society. It comes with the current idea of including the lived experience of people who have gone through mental health problems and through recovery, their families, their friends. So what it means for us is to make more use of the experience of the users of psychiatric services, their families and friends. Of course, for that you need a time and a place and a concept on how to do that and how to introduce that you need to learn how to communicate with people that you have known as patients but now are maybe your advisors or participants in the same work group, or maybe they are your vis-a-vis when you want to get hired. They ask you the questions that you need to answer in order to get hired, or they ask the CEO has to ask them whether they will sign his budget plans. So you come into contact with people that you have previously known as patients in other roles. So everybody needs to learn that. And some are faster learners in that regard and others slower learners. The policy is in place in all the influential English-speaking countries that usually influence mental health policy also in Europe, like in the US, in the UK, in Australia and New Zealand. And the users of services are already involved in all aspects of the service. Importantly also in training. So new staff gets to know patients already also in the role of teachers, so they have a better chance to learn. And then there is the concept of trialogue that started in the German-speaking Germany and has been around in the German-speaking countries for 20, 30 years now. It's a room where you can experience and exercise these new kinds of contacts, where people with a lived experience of mental health problems and recovery, their friends and families and people who work in mental health meet on neutral ground and discuss on eye level, accepting each other as experts, some experts by experience, some experts by training, and discuss issues around mental health problems and solutions.